Okay, and then, so are we going to let John go first or Mariah first? Who's first today?
I can go first. I am prepared, but if John, you would prefer, I don't mind either way.
Actually, if you don't mind, I do have another conference call with our reopening of our stores.
Yeah.
Okay, yeah, so let's let you go first
sorry,
then,
guys.
John.
Yeah.
Yeah, no problem.
Okay.
Because you'll talk about the walking versus strolling, and then Mariah can come in at the end and do the stretching post-exercise. So that actually might work well today. Thanks, Mariah. I really appreciate your flexibility.
Yeah, I really appreciate that. Thank you.
Yeah, awesome. And I see Chris William there. Hey, Chris. Super duper. There's Melissa. Doug.
Good morning.
Good morning.
Good morning, people.
Hi, Blair. Hi, Bill.
Good morning.
Good morning, Chris. You got to turn your camera on. You got to click the button on the bottom left-hand side so we can see your face. Unless you're just got out of the shower and you're still naked.
No.
We always joke about that when I do Zoom meetings. If somebody doesn't show their face, we're like, "Hey, you still in your bathrobe or what?" Yeah. Okay.
Am I in? Can you see me?
We can't see your face yet. So on the bottom left-hand corner, there'll be a start video and stop video button.
There is?
Yeah, just click on that, and then your camera should pop up. If you have a laptop, you have to make sure your laptop is open as well. I learned that the hard way. I've kind of got a big screen and a little screen, so you have to make sure your laptop camera is on. A lot of the older digital big screens don't have the cameras on them, so that's what I have at home here.
No idea.
Yeah. Okay. Doug, do you want to turn your camera on so we can see your smiling face?
It's on, isn't it?
No. Or
Oh,
Belle,
perfect.
can you turn their camera on, or is there a restriction on your side?
Well, I thought it was on. So
people can see each other a little bit here.
I can see a mute button, but I can't see a camera button.
Oh, okay.
Yeah, I've got the same thing at my end.
Okay, that's
Got
weird.
the mute, but I don't see a video.
Camera button?
No.
Is there a camera button on your end, Belle? Is the
Yes, let me just
coordinator?
check on the settings.
See if you can put the camera on for those guys. Yeah. And so we're in for a treat today, guys. We got John sort of like on location outside because he wants to talk about walking versus strolling, which I think is really important. Talk about interval walking to sort of get your heart rate up. So those will be kind of fun. And then we're going to let him present first because he has to zoom off, no pun intended, to another meeting. And then Mariah's going to come in and talk about hip and knee stretches for us. And these are the stretches that you want to do after you walk to reduce your knee and hip pain as well. We talked about the ankle and foot last week, so we're kind of going to go up the connect chain this week. So I'm really excited to have Mariah do a presentation on stretching as well. She's one of our amazing massage therapists on our team. So are we ready there, Belle?
Yeah, maybe one more minute.
Okay, we'll just let a few more people chime in here.
Mm-hmm.
And then we'll get John going. All right, so let's, did you want to do the housekeeping, or do you want me to start with one of the questions? Do we have a new icebreaker question for today, Belle?
Oh, I don't have anything prepared right now.
Nothing prepared? There you go. Okay, so my burning question is, and everyone get their chat box ready. Has COVID-19 changed your purchasing behavior? All right, so yes or no?
Oh, yeah. Okay.
somewhat.
There you go. Yeah. So I'll see a lot of yeses here. That's good. And it should actually, just for your own safety. I know my neighbors, they're millennials beside me, and then I got the opposite. On one side I have like seniors, the other is millennials, and the one house, they get a box every day from Amazon. You know, it's funny. And when I first met him a couple years ago, he said, you still read the newspaper, Blair? And he kind of looked at me like I was weird, eh? You know, he goes, I just read it online in the morning, you know. And I was like, yeah, I guess you could do that now, because I'm kind of old school too. But anyway, yes, I think it has changed our society overnight. You know, the essential services like groceries are still open, but do be careful in the stores you go to. They'll start to open probably in the next week or so. So just make sure you distance yourself from people when you're at the store. And certainly if you touch anything in the store, make sure you sanitize your hands when you get back in your vehicle. So keep sanitizer in your vehicle as well if you can. All right, so that's my little fun question for today. I'll hand it over to John now. And if we're ready, Belle, we'll let John start.
Yes, we can start.
Okay. All right. Did you want
Good
to do
morning,
any
everybody.
housekeeping, Bill?
Morning.
I think we're good, are we? Yeah.
Yeah.
Just everyone that's been here, were they here last week? Do they know John? Do you want to introduce John?
I
maybe,
can, I
Bill?
can reintroduce John for those people
Yeah.
who just attending right
Yeah.
now. So
Sure.
our guest for today is John Hyrstak. He's the area manager of the running room and have been with the company for 10 years. And his background is actually kinesiology. He was a massage therapist as well. He's also a teacher. He was also a teacher at a massage school, specializing in clinical assessment and anatomy. He spent most of his life participating in high-level sport of rugby to international field hockey. Now his passion is golf and running for fitness. Let us all welcome John Hyrstak.
Yay.
John?
Thank
All
you
right.
very much, Bill and Blair.
Okay.
Well, good morning, everybody. As you can see, it's sunny and clear skies in Calgary, the northwest of Calgary. And today we're going to be talking about the difference between walking versus strolling. So if you've ever seen a group of runners and they're doing our famous interval run walk program, we use the walking phase when we're running to sort of limit injury, give ourselves a little chance to recover, and then we can go back. And also interval training in general, it's good to sort of raise and lower your heart rate over a period of time so that you've got that muscle actively changing how it works. But the same thing can be done for walking. So when we have our walking programs, we have the same intervals, but how do you change when you have a walking phase? Well, there's two ways to do it. There's the walk phase, and then there's what we call the stroll phase. Okay, so back in the kinesiology days when I was in university, my favorite subject was actually biomechanics. Okay, and we talk all about the physics of it. Okay, so if you were to look at somebody walking, they don't walk with their hands by their sides, okay? They actually, the arm that's opposite the one leg, sorry, I'm in shorts, it's not for short weather. The arm opposite the leg that's forward moves forward, and that's for balance. That's a natural way for you to maintain balance while you're walking, okay? Now, think of your arm as a giant lever, okay? Anybody ever seen a grandfather clock with the pendulums that swing underneath to keep the time going? The weight on those pendulums, if you move that weight up the arm, that shortens it and it makes it go quicker. The weight going down to the bottom makes it go longer sweep, okay? And the same thing is happening when we walk. So if you were to bend your elbow, you're shortening that lever and that weight, okay? Sorry, just give me 1 second here. Sorry, we got to go back to the video. Where are we? You guys see me? There we go. So when you shorten that arm, you're shortening that lever arm, okay? And that means that when you're walking, you have a shorter arc, okay? I got some walking stats in here right now. So the walking phase for fitness, we're going to have short strides with our elbow at 90 degrees, right? And that gives us a quicker stride, quicker turnover. When we go to the strolling, we're going to let that elbow relax, moving the weight and the lever arm are making it longer, and that slows things down, okay? So when you're doing your intervals, when you're walking, you want to have the elbows bent at 90 degrees, and that will force you to have a quicker stride when you're walking, okay? Whereas when you go to the stroll phase, you're going to let that arm come down, and that's going to lengthen your stride and slow things down. And the whole point is that during your recovery, when you do your walk intervals, okay, now I'm going to here's my strolling. That slows me down, I let my heart rate come down. It also lengthens my stride, okay? So my walking stride, I don't know if you can see it, my walking stride lengthens, and that allows us to do a little bit of a stretch, an active stretch while we're walking. Okay? So the idea is that you still have your intervals with a brisk walk with your arms here, okay? Nice and short strides, followed by a minute of strolling, okay? You don't have to slow down, but you do have to sort of lengthen that stride. And that will slow you down enough to have your heart rate come back down and also stretch out some of your muscles that for walking. So your groin, hamstrings, glutes, all that kind of stuff will stretch out and give you a little bit of a break.
Yeah.
Okay? The main thing when you're doing this phase is while you're doing that brisk walk, okay, you can do that up to 10 minutes, 20 minutes, but you want to throw in a stroll of at least a minute, okay? So have those intervals. So we usually start off at 1 minute brisk walk, 1 minute strolling, times 10 or times 20. And we increase the brisk walk and just keep the 1 minute stroll, okay? And that way you can limit the amount of injury or the chance of injury, but you can also extend your distance over time because you're going to let your heart rate come back down, recover slightly, and then have it come back up. And if you did that the first week, even 3 times a week, and you just did 1-and-1s, which is 1 minute brisk walk, 1 minute stroll, by the week 2, that next step up where you go to 2-and-1s or 3-and-1s is very easy. Okay, it doesn't take long for your cardiovascular to really start to come back as you start to do this brisk walking. Now, I personally, I brisk walk everywhere. I don't have a very casual. I can't stand. I'm glad that my kids are getting older, that they have longer strides, so I don't have to slow down for them. And then the other day we had the kids out there on their strollers. One of them fell over, and I'm like, "You're okay," and I kept going. They had to catch up. My wife is always saying that I look like I'm in a hurry to get to places. But it's important when you're doing this fitness walk that you throw in that recovery, okay? Make sure that you're having good contact with the ground. You have a nice heel, roll forward towards the toes, and a nice push off, right? And that your arms are counterbalanced to you, okay? And if you need to speed up or you just need to increase your arm speed, if your legs feel tired, move your arms faster because the legs will have to keep up, okay? If you want to slow down those arms by lengthening them and lowering that pendulum arm and making your strides longer. Hopefully that's been a little bit helpful with the difference between the two and how you can have intervals while you walk. Hopefully I haven't made you too dizzy by turning around and walking up and down my front street. But is there anybody have any questions with that?
Yeah.
Go ahead, guys. The mics are open, so we decided to unmute you today. So go ahead.
Okay, I have a question about walking this way, going uphill and downhill.
Okay.
Is there any change that we?
Yeah. So think of, I always think of anybody who's my age at least knows who the Flintstones are, right? And Fred Flintstone always used his heels as brakes in his car, okay? So when we're walking, our heels are our brakes. So if we're going downhill, we're going to have a more pronounced heel strike to slow us down as we go, to slow down our momentum and gravity. So you might want to shorten your stride as you're going downhill, okay? Because A, that will prevent you from overextending your foot, and you can sort of slowly ride the brakes down the hill. Going uphill, of course, you're not going to be on your toes, on your heels as much as more as your toes and sort of climbing, okay? So again, you might have a shorter stride where the foot's coming underneath you, but you're going to be having a lot more push with your toes, kind of like walking upstairs. You're not going to walk upstairs on your heels, right? So there is a variation. The big thing is that you can control going uphill or downhill the same as on the flat, just with your arm speed alone. People don't realize how much their arms really affect how fast or slow they walk. So keep in mind those things. So if you're going uphill, try to keep the same cadence, and the cadence is your turnover. Your legs as the step rate, that metronome of walking. If you're walking on the flats and you've got a nice brisk pace, and then you start going uphill, your stride length might shorten, but the pace or the cadence, that leg turnover, stays the same. If you're going, if you're into that stroll phase, you're going to slow down that stroll, but up or downhill, you're going to, even though you might shorten or lengthen your stride length to accommodate for the gravity, keep the same cadence, okay? The goal is to have that same leg turnover, and even though stride length might change because you're going up or down, you want to just sort of keep that in mind that your arms are going to be the ones that dictate cadence and speed. Does that help?
Yes, thank you.
Yeah. Awesome.
That was great. Any other questions, you guys, before John switches to his next meeting?
I can't read that full one, but maybe Blair, can you maybe read that for me?
Sure. Let's see here. I'm going to open up the chat box here. It says, oh, walking sticks. Yeah, great question. So Kathy Voice put in the chat box that she said walking sticks. So have you ever
Yes.
given any advice for walking sticks, John? What are your tips for that? So pole walking, I guess.
Well, generally speaking, the two reasons you would have poles is one, because you might have some issues with balance, okay? The proprioception muscles, if there's a spinal impingement or something like that, or if you're trying to get a little bit more action for your arms, right?
Yeah.
So again, it's a matter of remembering that those poles now just extend your lever arms from here to all the way down to the ground, right? So if you have a short stride and you have your elbow here with your pole, right, and then you go to the stroll part, you're going to have that pole sort of lengthen out in front of you and really sort of kind of hit behind you as opposed to driving you while you're in that rest phase. So the main thing is going from here to here with your elbow and still having that wrist flexion sort of with the pole contact. But the pole is there. If you're using it for balance, it's still going to give you that contact. But again, the main control factor is your elbow. Okay? So when you're doing the short stride, you can still keep your elbow at 90 degrees, and the pole contact is going to be a little bit shorter, right, with the ground. And then when you go to the stroll phase, you can just have that pole kind of hit beside you and lengthen behind you, and you still lengthen the lever arm and you can slow things down. Awesome. Going downhill, you can use them as a little bit of a brake, right? And going uphill, you'd be having it contact you beside your foot and pushing down that way. Right?
Awesome. Kathy says, thanks.
Yeah.
Check the chat box here. Looks like you don't have any other questions. Just a quick comment on that. When I had my hip resurfaced a couple years ago, I worked really hard to get off my crutches, and within 6 weeks I did it, and I was so proud. And 3 days later, I saw my surgeon. The first thing he said to me is, Blair, you're ahead of 90% of the people recovering from the surgery. He says, now you need to go out and buy poles. So he actually got me to buy poles, and he said, it'll increase your cardiovascular output because your arms are moving. Plus, you can increase your volume now. It'll just keep you safe over the next sort of 4 to 6 weeks. And he obviously gave me precautions. He said, no hills, just keep it flat for now. But he said, after another 6 weeks, you should be going up and down hills as well to work on building your endurance and your function back. So that was very good question there, Kathy. So anybody who has a total hip or knee replacement, it's a great way to sort of get you moving and build your endurance back up once you get off your crutches. So great question, Kathy. Does anyone else have any burning questions for John?
I have a question about
Cheryl, go ahead.
So I have a question about pole length. So
Yeah.
I'm pretty short. I'm 4'11". When my poles, should I have them as long as like my elbow length when I'm standing still?
That is a good question. I would say that you don't want your poles too tall. You don't want them too high. You don't want your elbow sort of coming above 90. I think that having them at 90 is still, you can still break if you need. But if they're too high, then your elbow is up here, and that puts too much, your arm's not swinging as far as it needs to. Okay, think of that. You're moving the pendulum, the weights on the grandfather clock. You're moving them further up the wire, up the chain. So having it so that your arms are at a nice, comfortable 90 degrees, that should work. Now, again, we don't deal with a lot of we don't sell poles at the running room, and we don't deal a lot with them. This is more from just experience with walking with your arms. I would say I would keep them at 90 degrees. It's a little bit different than like cross-country ski poles where they're a lot longer.
Okay.
Because your cross-country ski poles are there to help drive power, and these poles aren't really for power as much as balance and a little bit of resistance, right? So I would say at the 90-degree level is probably the best. You don't want your elbow bent up here.
Okay. Thank you very much.
My pleasure.
Awesome. If you guys are looking for a source to buy the poles, Louis Stack at Fitter First carries the poles as well. And he only brings in high quality stuff, and he tested himself, and he's about to have a knee surgery or knee replacement here in the next couple months as well. So he totally gets the idea of the pole walking, and especially for the older generation, which he's now a part of. I always tease him, he's older than me, so I give him a hard time. So there you go, guys. So just www.fitter1.com is Louis' website. You can just buy him right off the website. Good. Any other questions for John? No? Okay. Thank you very much, John. We really appreciate your presentation today. That was awesome.
Yeah, I've got to go and we're reopening some of our stores in Alberta, so awesome. I've got to go and get them organized. So
super duper.
We will see you guys next week.
All right. Okay. Thanks, John. I really appreciate your time. Take care. Bye-bye.
Bye, John.
Bye.
Bye.
Well, that was really fun, very interactive, and he sort of did some great demonstrations. So I hope you guys took something from that. And great questions, guys. So 3 great questions. One on sort of how to manage the hills. Second one was, Kathy talked about pole walking. And then Cheryl asked about the size of the poles. So it is 90 degrees, those of you if you're in the store. And most of them are telescoping now, so you can adjust them quite nicely. So with that finished now, we'll move on to Mariah. So Mariah, as you guys some of you may have met her. She's one of our massage therapists on our team. And she does an amazing job with stretching and teaching people stretching techniques. I've actually learned a lot from her. So I'm just going to pass the floor to you, Mariah. So go ahead and let's talk about hip and knee stretches. And let's welcome her with a quick round of applause. Yay!
Fantastic.
Super.
Thank you guys so much. It's very nice to see all the familiar names out here. So today we're going to talk about how movement can really be a beautiful form of medicine for you guys as we get back into the swing of things and how we kind of get moving forward. So more specifically, we're going to talk about how stretching can be used to prevent injury as we get into our walking and strolling. So, excuse me, to start, I like to think about our tissues in our bodies, our muscles, tendons, all that fun stuff as kind of like an elastic band or a rubber band. So that elastic band, when we stretch it, it's going to just about always return back to its original shape up until a certain limit, or we call it a stretch boundary. So that elastic, when it's stretched, it's going to recoil and come back to its natural form. We think about when we stretch as maintaining those stretch boundaries for our muscles. So what we're doing is we're actually giving our muscles more ability to be flexible, more pliable, and it makes our tissues more fluid and less prone to injury. So when we don't stretch, unfortunately, the converse effect happens. Those tissues, they get used to that small space and they get kind of shortened, almost brittle, like those older elastics that we get used to. You go to stretch it and it almost cracks or snaps on you. So when we leave our muscles alone for too long without a stretch, they do get quite shortened. So that lack of stretching, it leaves us with tightened, shortened muscles that are more susceptible to injury and things like strain and sprain, right? So I like to call this the elastic rule. It's a nice little kind of ring in the back of your mind just to remind us one of the big reasons of why we're stretching. And then the other thing is when we get used to this tight, small stretch boundary, it becomes our body's new normal. And then your body will have a cascade of effects that basically happen to try and make your normal more normal, to make it more regular for your body. So those those changes that happen, because we are creatures of habit, our body is not too fond of the changes, unfortunately. So because of that, we end up with outside issues that sometimes can develop in the process of those changes happening. So things like a limp that develops over the course of a great period of time. If you're putting a lot of weight into one leg for a longer period of time, you're going to have things like overuse issues that stem off of that joint that come back from your body avoiding the use of that tightened, shortened muscle. So what we do is our bodies make these full-time but not quite permanent changes to balance out these problems. If that problem is around for too long, that's when you start to see those injuries. So what we're going to do to get to the root of avoiding these injuries all told is basically just stretch. When we stretch, what we're doing is we're getting our tissues to be more soft and more flexible, and we're preventing our body from ever getting into that new normal cycle to begin with. So thank you guys so much for listening to my little blurb about the whys of stretching. Now we're going to get into some of the fun stuff. I have 5 stretches for you guys that are going to be really must-knows for the pre and post. Really, post is better, but if you do them beforehand, it's better than not at all. Stretches that you can get into your routine that are going to help you get moving without any of those injuries ever happening in the first place. So I started off here on the floor because my favorite place in the house is on my yoga mat. So I'll just back up here for you guys a little bit. And then we're going to start with a really nice hip flexor stretch. So a lot of us throughout our day, we spend a lot of our time with our hips rolled forward like this. And that gets really, really tight, this shortened area between our hip and the thigh crease. So what we're going to do to open that up is we're going to start on our knees here, pop up into a kneeling position, and we're going to throw one leg forward. And that leg is for stability, okay, guys? So we're not going to wobble around too much. What we're really trying to do is to create a nice straight line from the knee up the hip. So once we're here, you're going to take one hand, pop it on the back of your butt, and you're just going to lean forward into that stretch a touch. And what that's going to do is it's going to open up that space in the hip crease and really open up that pelvis. So this is one of my favorite ones for people who spend a lot of their day sitting. And you know what? I've been watching a ton of movies the last little while, so this is me. So the big things about this are to tuck that bum underneath, and then you really want to think about pulling up through the thigh while you're here. So this is for one side. So you would hold that for about 10, 12 seconds and do it about 2-3 times if it feels tight. You can get down to 1 or 2 if it feels really comfortable, but I like 2 or 3. So then you would flip onto the other side, put the other leg up, and put the other hip through. So that's our first stretch. That one, I like to call it the proposal stretch because you're down on one knee for yourself. So our next one is going to be a glute stretch. And this one still takes place on the floor. What we're going to do here is take one leg and cross it up to the other knee. Yep. Then from here, we're going to reach down. If you don't reach the knee, that's okay. It can be down at the ankle. It can be anywhere between ankle and knee or above knee. What we want to avoid is being right on the knee joint, but somewhere on the leg, nice and comfy. Then from here, I call it the thread the needle because you're going to take these hands and put it right through the hole that you just made in your legs. Then grab onto the back of your thigh, and nice and comfortably, you're just going to pull your legs up towards yourself. You're going to feel a nice releasing stretch across the back of the hip of the bent knee, the one that's up and across. And what that's going to do is it's going to keep your glutes nice and loose and able to be moved when you get back into walking. So that walking, that power stroke that you're doing, that comes from your glutes. And you really got to stretch those bad boys out so that they can have the power to get you moving. So the other one that we would do for the other side is, again, you would take that one ankle, pop it somewhere up on the leg. We're going to thread our hands down through the thighs and then lift up. So again, like I said, if you have that ankle really low, that's okay. You're just going to really focus on getting your chest up and keeping things nice and stable. And it's really just about movement in that hip. Okay, guys? So that's our second one, and I call that the thread the needle because that movement through onto the leg. If I'm moving too fast for anybody, please slow me down. I do tend to get going a little bit. So the next one that we're going to do here is our hamstring stretch, which are the bad boys on the back of the thigh. And this one is pretty straightforward. You think that old school peanut butter and jelly sandwich kind of thing, but we're going to dial it back a little bit because that can be really intense for a lot of people. So what we're going to do is walk the heels up a little bit closer to the bum. Then you're going to take your hands and try and grab onto your feet. If you're way up here or if you're way down here, it's okay if you have to lean really far forward to try and grab onto those feet. But then from here, once we've got a grab, I also have a little band here. So if that's not happening for you guys, bands are a great option. You can band onto your feet. And then what we're going to do is just slowly, with our chests nice and high, walk those heels back down towards the mat or towards the ground. So again, you're keeping that chest nice and tall. I don't want to see too much of a rounded back here. And that's going to really make sure that the stretch is coming from your thighs and not from your back. So we're going to grab onto those toes, and this one you only have to do for once because you're hitting both legs in one movement. So you're going to grab onto those legs, walk them down nice and slow. And again, this is a 10 to 12 seconds that we're going to hold this for, and if it feels really tight, like I said before, we're going to do 2 to 3 times of that stretch, and we're going to have, as that gets less tight, you can drop it down to once or twice a day. Sound okay? Perfect. Speeding through our 4th stretch, the next one here is going to be a quad stretch. So this one I do standing, so I'm going to crank this up just a touch so you guys can see just from here down. So I like to have something to hold on to on the side here just to make sure that if I did get a wobble, I would be okay. So keep a hand on something nice and stable. And then what you're going to do is you're just going to kick your heel up towards your butt. So I know this is a pretty straightforward one. Lots of people teach you this, but the thing that I'm going to stress here is that you're really going to try and squeeze your calf, your heel towards your butt. Just really almost imagine that you're trying to pinch a ball back there. And squeeze, 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 squeeze. And what you're going to do then is push the thigh down. Remember that straight line down the knee from the first one? We're going to try and imagine that exact same thing, just nice and straight down the thigh. And that's going to stretch the front of our thighs or our quads. So this one, you really want to make sure in your tummy, you're tightening up and making sure that there's not too much wobbling, the same way that we want to hold on to something and prevent that wobbling. And then the last one that we have here is one of my favorites, just because it feels so darn good. And we're going to be back seated on the yoga mat here. You can grab a band if you need it, or you can use your hands depending on your flexibility level. I like to have a band handy, just because it's more comfortable. Even if you can reach your toes, sometimes it's not nice during, you have a rough day, you just want a more relaxing stretch. Just to ease into it a little bit, you're gonna hook the band onto the toes, and rather than working on pulling yourself down, you're gonna work on pulling your toes back towards yourself. So you can do this with 1 foot at a time, or you can do it with 2 feet at a time, just depending on what you feel comfortable with. But you're really going to work on just kind of squeezing back and forth and pulling those toes up towards your nose as close as you can get them. How's that sound?
Yeah. That's fun.
Awesome. I'm so sorry if I moved too fast for you guys. I do kind of get that pace going, but I hope I covered everything for you. And if anybody has any questions, feel free to give me a shout, okay?
Would we be able to review those on some site of yours?
Of course, yeah, for sure. You know what, I think Belle is actually recording this whole session right now, and I believe I'm speaking correctly when I say that this will be posted on somewhere through our Facebook or our websites for you guys to have access to after the fact.
Oh, wonderful.
Okay.
Thank you.
And if you guys have any more specific questions regarding to like more specific muscles or specific stretches that you had more questions or problems with, feel free to give me a shout via my email, or you can contact through Belle and I'll get back to you through that way, okay?
Great.
Awesome.
Thank you, Mariah.
Yeah, no worries, guys. Like I said, it's so nice to see all the familiar names. It's nice to hear from you guys. All right,
awesome.
Pass it back to Blair and Belle here.
Okay. That was great, Mariah. So, And that's what I love about Mariah, is that when you're doing stretching, a lot of people think, oh yeah, I do a quad stretch. You know, they'll do it in the office and they'll say, well, let's actually see how you do it. And there's a lot of little tips that can really refine your stretching. Like that one today where you want to drop your thigh down. As soon as I did that, I thought, wow, there's that stretch I'm looking for, you know? So it's funny how just a little teeny tip can make a huge difference in your flexibility training. So I really want to thank Mariah for that great presentation today. We will get Bill to send all you guys for attending today, you'll get a stretching sheet that we use in our office that she can email to you. That's those 5 stretches. It may be a slightly different version, but at least you'll have something to fall back on. And again, if you're still struggling with one of the stretches, you're not quite sure, then definitely follow up with Mariah and she can help you with that as well. Yeah, we can sort of go from there. So do you guys have any specific questions about the stretching post-walk?
Is there a time period which it has to be done by?
I like to say that you want to do it within your cool down period. So before you get back to that kind of stagnant point where everything is just resting, after your walk, you're going to feel kind of like your heartbeat is up and you're warm for a time. Usually for people, it's about a half hour to an hour afterwards. Yeah. That's the window that I really like to stretch in because it feels the nicest. If you want to stretch while like at the very end of your walking routine or at the very end of your cool down, there's really not a whole lot of discrepancy there. As long as it feels good for you, you'll get a better stretch out of it that way.
Great.
Hello. I was wondering about the Achilles tendon, and when I've gone walking, I usually come back to the house and I put the face of my palms against the side of the garage.
Right.
And then I try to stretch one leg at a time.
Right.
To stretch that tendon.
Right.
And I'm always fearful of maybe overdoing it one day, and I find that this helps to keep it in tune.
So the cool thing about your Achilles tendon is that the tendon itself is not going to get any longer or shorter. It's the muscle attached to it that really poses the problem. And you know, you hear about people who have those horror stories surrounding ruptures and things like that. That can be almost completely avoided when you stretch that calf muscle. So that last stretch that we did together with the band and working on pushing the toes up and down, that's going to strengthen that muscle and in turn keep it that soft and pliableness that we were talking about in the beginning. That's going to keep that tendon really nice and happy so that there's no stress really ever being put directly on the tendon, if that makes any sense.
Yeah. Oh,
perfect.
Perfect sense.
Awesome.
Bill, can you send Davis that heel drop program as well?
Sure.
Davis, I'm 50, well, going on 52 now. I do the heel drop program more as a maintenance basis for my tendon because I've had a lot of friends that have ruptured their Achilles tendons in the last probably 10 years. And so I do it just to maintain it. So there is a way to they've done a lot of research behind loading it eccentrically. So that's something we can send to you. And then if you have any questions, you can follow up with either Mariah or myself to sort of help you with that. Because you're in BC, we should, try to get you going on a bit of a preventative thing. And then if you do get stuck and you need some help, just let us know. Because I know a lot of physios across Canada that can sort of, you can head down to their office and they can sort of fine tune it if you need some help. What area do you live in, Davis?
Nanaimo.
Nanaimo. Okay, so you're on the island.
Yeah.
Beautiful area.
Beautiful. I've never had a rupture there.
Okay.
But I have had a little bit of a strain years ago. I'm 72.
Okay, good for you.
So,
yeah.
I just don't want to have that kind of a problem.
Yeah. So you can start that program, just go really slow with it. And it's described quite well. And then again, if you have any questions, like read it, just send us the questions and we can respond back or we can jump on a call and help you out for sure. Because that is one of the, no pun intended, the Achilles tendon is one of our weak spots of our anatomy. And people joke about that, but
it's true.
Yeah, but they've done some research and it was wonderful. And it was done by actually a PhD researcher who now lives in Vancouver. And Kareem Khan I met quite a few years ago, and he's the one that actually came up with the term tendinosis. And so he used to be in Australia, but then he met a Canadian researcher. So that's why we have him in Canada now, because he married her, and she's an osteoporosis researcher who I love to pick her brain every once in a while as well. And so they were both in Vancouver now. And so Kareem works at the UBC Sports Medicine and actually mentors a lot of PhD physios now. So he's right in the mix of stuff, and he's the one that basically, and then once he did his study, there's 6 other people across the world that kind of replicated it. And like Kareem says, there's only like 6 or 7 guys that are kind of at his level talking about tendons and things like that. So
Oh, wow.
yeah, so that's been really validated. And since they did it with the Achilles tendon, they're now doing it with a lot of tennis elbow patients. So we do that in-house as well for tennis elbow patients.
That's another one for me.
Yeah. And all their tendons wear out. And Mariah said, why? Because our muscles get shorter and shorter if we don't stretch them. And then they start to traction the tendon on either end of the bony attachment. So we're all prone to getting tendonitis if we don't stretch. And we see that with all the trades guys that come in that are gripping all day long, like the plumbers, the electricians, and things like that, because they have these Popeye forearms, and millwrights and guys that work in sawmills when I was in BC, but they have raging tendonitis on either end. So stretching is really important part of your day-to-day life that you want to kind of make as a bit of a routine, post-exercise for sure.
Okay.
Yeah, awesome. So do you guys have any other questions for Mariah about stretching for today?
I don't know does stretching have anything to do with improving osteoporosis? I know it might have something to do with the bones, but I don't know.
Yeah. So osteoporosis, all the research points to that weight bearing is what stimulates bone growth. So that's more of a mechanical loading of the bone to prevent osteoporosis. And then the stretching is more for the muscle and tendon unit because bones don't stretch, certainly, but muscles and tendons do. And it's their muscles that attach to tendons on the bone that generate the movement of our bones, when like John was demonstrating his walk there. So it's those muscles contracting that are forcing those bones to move. So the more active you are and the more you're walking, the healthier your bones are going to be. And again, coming from Kareem Khan and his wife, she figured out a few years ago that the bone capacity and potential is set between the ages of 10 and 14. So those of you that have any grandchildren, make sure your sons and daughters are getting those kids into soccer and activities where they're running around lots between 10 and 14, because she came up with a model that said that's when the biggest potential for bone growth is. And it's like you're presetting your bone capacity for your life. Excuse me, because after a certain age, and our anatomy professor in university joked about this. Excuse me, got a tickle in my throat. And she kind of said, overall, your anatomy is all downhill after age 20, which is kind of depressing, for us back when we were in that age group and we were 22, 24. And so she said it's a slow, natural decline. We were growing like crazy up into about 20. And then she said it's just a natural sort of decline for all of us. But that was really, really interesting research. So I always share that when I'm talking about, when I do presentations on sitting disease and just talking about how bones soften if you sit all day long. And then I usually make that comment about, make sure your kids and your grandkids are really active to set that bone potential. So great question, Cheryl.
Thank you.
Yeah, so the more you're active, the better bones you're going to have for sure. All right.
Thank you.
Any other questions?
Right,
do you have any
question?
Oh, sorry, go ahead, Melissa.
For stretching, can you stretch any time, or do you always have to do some kind of activity first so that your muscles are warm?
Great question. Mariah, do you want to comment on that?
I sure can. The rule of thumb is actually, if you're going to stretch from cold, that whole you want to stretch when warm thing, that comes from you want moving blood through your muscles. So the trick that I go by is if I stretch cold, I always stretch in movement. So that's when you think of things like dynamic stretching, when you're doing things like short yoga routines or like a light squat, just to kind of get your joints moving and get some fluid going through your body before you get into those really static held stretches. The more intense stuff, I say that you should probably hold on for that for when you're more warm. But once you get into that warm state from something like a dynamic stretch, you are good to go.
Thank you.
No worries.
Yeah, so So my philosophy, just to quickly chirp in on that, is so from a sports medicine point of view, you want to do that stuff dynamically to kind of get your body moving. So it's actually dynamic, fast sort of movements is what going to kind of prepare your muscle for the event that's about to happen. And then post-event, you want those static, prolonged stretches to kind of get the body calm back down again and get the tissue back to its natural length. Does that make sense?
Yes.
Yeah.
Yes.
Yep.
That's good. Super duper. Okay. And then Kathy chirped in on the panel saying, are you guys open now? So I can, let you guys know that we officially did open on Monday, yesterday. We have had some urgent cases in the office last week that I treated that were guys that are, really bad discs and that they're getting MRIs done. They're WSB patients that aren't doing well. So we kind of tested our safety procedures with them. They're all loyal clients of ours, so they know us really well. And I'm pretty confident now to say, after Bill, and I want to thank Bill for working really hard on setting up all the safety precautions, that we're pretty insulated now. So if you do come in, we don't see the same volume of patients. So that's why we're encouraging people to do an online screening to make sure that, we can figure out what's the best way to manage you. And it really depends on your injury too. Some people will need more hands-on care than others. And a lot of what we do in physiotherapy is 90% communication. So it's, we diagnose what's wrong, we teach you what not to do, and we teach you what to do to help you, and we coach you through a recovery, essentially is what physios are. And some people, if it's exercise prescription, have done really well the last 6 weeks since I've done this online. It's amazing. But if somebody hits a plateau or they hit a bit of a pothole, we're quite happy to bring them in, do a quick tune-up, get them back on track, and then away they go. So we're basically, our model is now changed into a hybrid model of both online and offline or in-house sort of physical treatments. But due to the healthcare restrictions, we can't see the same volume. So we are trying to treat people both online and offline. And we're happy to help you out in any way we can. So our intake process, and Bill and I are sort of playing with this week, is that we're going to do what we call virtual discovery visits for all new patients coming into the clinic. So we'll meet you online, we'll book a half-an-hour visit, and we'll talk about the 4 key questions we always ask everybody on intake. We'll figure out what your why is and make sure there's no red flags that we need to screen first medically. And then we'll set some goals, and we'll make sure that we can make a difference in your life. And by doing that, I think it really sets people up for success. And then the next visit is either in the clinic or online, depending on what our responses were from that session. And then we can get going on your rehab right away. And really, the next visit is kind of a deep dive into your history, previous injuries, and things like that we can sort of put the pieces of the puzzle together. And it always amazes me when you really dive into your history. If people come in with pain, there usually has been a history of a previous injury in the body that's now, like Mariah said, making them walk abnormal. And there's all these compensatory muscles that are tight, that are being overloaded and causing tendinitis and then tendinosis, so tendinosis is a mechanical breaking down of the tendon. Tendinitis is more at the start of an injury where there's swelling sort of for 3 weeks in the tissue, and the tendon is very uncomfortable and very inflamed. So that's when you want to be resting it and slowing down. And like the research that Kareem Khan taught us is that you do actually have to load that worn out tendon, because when you load it, what happens is it physically actually grows back. So it starts to get bigger and thicken to prevent the tendon from tearing in the future. And so that's what the heel drop program was for the Achilles tendon, and what we're doing for tennis elbow as well. Does that make sense? I hope that's clear. Yeah. So we won't just be a full in-house treatment. There will be some patients, but the majority of people will be treated kind of in that hybrid model. So I hope that makes sense. And we're excited nervously excited to get going again. We're concerned about all the health and the reducing the spread, but we've done everything we can in our office. In fact, I've consulted with my brother-in-law, who's a firefighter for the city of Calgary, but he's real passionate about sort of hazmat. So he deals with a lot of industrial spills where they have to be really careful because of all the chemicals, that are flying around in the air. And so we've set up all our functional stations are now cleaning stations, so that we can make sure anything that's touched gets cleaned with bleach water. We're trying to make sure our assistants are safe. So we've got them gloving up when they're using that water. We just ordered some safety glasses as well, so that we're going to be careful. So in case bleach water flies up into their eyes. Yeah. And there's a tube at each station for us to demonstrate exercises, but then it's washed and cleaned, and it's hung on a dry rack, and then we just put another tube in. So really there's no communal use of anything, and our gym is closed, which is unfortunate for us, because at Nose Creek we're really passionate about getting people sweating, like Mariah knows this, to get their blood flowing and really warm them up so we can mobilize and manipulate and really get the tissue and the joints moving. But what we're telling our patients is if they have a little routine is to do that routine before they come in, both for physio and massage, to really get their tissue ready for the intervention that we can offer as well. Yeah.
Interesting.
So Blair, if you're a returning patient,
Yep.
is it best to call and make an appointment? And because you know that what you need, what you need. Like I'm thinking of Dave with his neck, right?
Yes. Yeah. So basically, give us a call, and if it's Dave, your husband, we can definitely get him in for a follow-up visit. And if it's something that we've already treated routinely and we're kind of doing a bit of maintenance work on, with that person, I wouldn't put them through the intake. And we're going to fine-tune that with Belle as well. But yeah, we're talking about new patients that have never been to our office before. But certainly follow-up visits, loyal clients, we would probably fast-track you right into the clinic for a physical checkup. And then, if Dave's out of town and his neck starts to get sore, we could, in that case, virtual works really good. I've actually followed people as they travel across Canada. I've got one guy that I love right now, Gordon. He lives actually in Edmonton, and I'm doing virtual treatments with him, but he has family members in Cochrane. So he sort of goes back and forth. And so I think we've done 3 virtual online treatments with him. And I'm happy to kind of finally meet him face-to-face next week in the office because he's in town for a couple weeks, and then he'll go back to Edmonton. So we're slowly building out his rehab program for his knees, which have become a bit of an issue. But super active guy, just like Davis. I'm sure I think he's 72 now, and just starting to, notice his knees are getting a bit stiffer. And so we're trying to educate him on how to better manage his knees and keep him as strong and as fit as he can. And patients like that, they're fun to deal with because he's got a bit of a martial arts background. And I did his balance test yesterday, and he passed with flying colors. I was actually quite amazed. I said, "Do you think you've got the best balance of the 72-year-olds that I've treated in the last month or so?" So I told him he wins the prize for the best balance. And so I had to really challenge him with some balance sort of drills, and we'll probably get some stuff from Hyrstak for him to take his balance kind of to the next level at home, because he's a very busy guy that's a consultant and running a company and traveling all over the place. So I said we'll be able to set up some stuff you can do on the road and at home in your home gym as well. So it's definitely a new reality for us, but we're excited to sort of embrace it and really go with the flow.
I have balance issues, not severe, but if I'm going on doing some hiking or something like that, that's when I really notice it.
Great comment. Yeah.
And I also have something which has been chronic with me since 55 or 60 years, which is Osgood's disease on my left tibia.
Oh, okay, yeah.
And it used to bother me when I was more athletic and I was sprinting, and it would my knee would kind of cave in after about 100 meters of sprinting or even less.
Okay.
But that doesn't seem to happen now, but it's still there. And if I'm kneeling, I certainly don't. It's very sore on that knee.
Yeah.
I'm also wondering if it's part of the problem with the balance.
Yeah, certainly. That could be inhibiting your balance for sure. Stay tuned. Make sure you don't miss next week's presentation because we are going to talk about balance.
Oh, great.
So I get to take the floor next week for balance, and then it'll be back to Mariah the week after that to work on some more soft tissue stuff. But the balance drills we'll go over next week. But Osgood Slatters, just for those of you who doesn't know, it is basically a growth plate traction injury that occurs. And so you probably would have had that in your teen years when you're growing like crazy. And the tibial tubercle, which is kind of a bump where the kneecap tendon goes down, we call it the infrapatellar tendon, attaches to the front of your tibia, which is your big shin bone that takes sort of 5/6 of the weight that goes through the leg. It actually starts to pull on that, and because it pulls on that, the bone tries to grow into the tendon, so you get a bit of an osteo or bone growth out. And that's why you shouldn't actually kneel on the knee, because when you kneel on that bone growth, you're putting a lot of direct pressure right on that attachment. And so I would advise you to kind of stay away from kneeling directly on the knee if you can, because that's probably going to irritate you for sure. At your age, the inflammation and all that is probably stabilized. Without looking at you, I'm just kind of guessing, but you probably still have a bit of a growth there because of the tractioning. And part of that could be a little bit of a muscle imbalance around your knee, Davis, that's causing it to track abnormally. If it tracks abnormally, that puts abnormal tension on that infrapatellar tendon, which could actually aggravate that attachment again. So I would ask you to really work hard on your hip and knee stretches that Mariah went over today to see if that does make a difference in your pain in that spot there. And then just avoid, if you can, kneeling on that for the next little bit. And then we'll work on some balance next week. And these are all great because these are what we call modifiable risk factors for any sort of chronic injury. We always look at the flexibility as being that first layer of the onion. And then the second one is balance and certainly some strengthening after that as well. Yeah, we wouldn't prescribe any strengthening until we've sort of had a good look at you, either virtually or, in the clinic as well.
Okay,
awesome.
Great. Thank you very much.
Yeah, you're very welcome. Any other questions, you guys?
No, thank you.
Awesome. Yeah, that was another great session. That worked out really well. I just want to thank Mariah and John for doing a great presentation and all the great participation. You guys had some awesome questions, and I really appreciate your interest and feedback. And we also like to end our sessions, and we haven't done this last couple of sessions, but we will today. So in the chat box, on a scale of 1 to 10, I want you to rate our meeting. So 1 being like the worst experience you've ever had, 10 being like the best experience you've ever had. And then the other question we'll often ask, so go ahead and everyone put it in the chat box right now. So if you can open up your chat box and just put in the number 1 to 10. There we go, perfect, awesome. Hey, that's great. So really appreciate that feedback. And then also too, if it wasn't a 10, we always like to know how we could make it a 10. So Belle and I will, you can just put that in the chat box right now if you want, because we're coming up on the hour here. But if you have any feedback for us, we're evolving this and trying to make it better and better every week and keep adding value to it. So we do love your feedback as well. And last week, the chat box for some reason wasn't working for Belle. So that's why this week we decided to kind of just open the floor and let you guys ask questions verbally. And that seemed to work better this week. So we might stick with that as long as we try to just, one thing I would ask is when the person is doing the presentation, if you guys can just mute yourself out, like I did, I kind of sat back and muted it because if I cough or I sneeze, then that kind of interrupts the communication from Mariah or one of the presenters. So yeah, if you can just mute yourself while the presentation's going on, if you got a question, urgent question, put it in the Q&A, and we'll definitely make sure it gets read into the presenter as a question. Or if you just want to wait and ask the question verbally, that's fine as well. So I really appreciate your patience and support today. And Bella, do you want to close the meeting?
Yes, I would like to thank everyone, and we'll see you again next Tuesday. We also have a presentation on Thursdays with a different topic. I can send you also a link to that presentation so we can see you this Thursday as well. And I will work on the video cam settings for next meeting so we will see your beautiful faces. And that's it.
Yeah, that'd be good. Awesome. Super duper. All right, well, take care, guys. So work on those interval walkings, 1 minute slow strolling, okay, with the long arms, and then short arms, and try to increase the velocity and the frequency of your walks, like John was saying. And let's get that done, and then afterwards do some stretching, and we'll see. You can give us feedback next week to see how your legs are doing with that walking interval walking, we call it. Awesome. Have a great week, guys. Take care.
Thanks, guys.
See you next week. All right, bye-bye.